Hi everyone, welcome back to our channel Ocean of Dentistry. So today we are starting with the oral surgery subject, that is introduction part of the nerve block, which is very important for your day-to-day dentistry practice. In your dental clinic, many of the patients will come for the extraction and you will need to give the block, maxillary nerve block, mandibular nerve block, so that uh, least painful or without pain extraction can be done properly under the local anesthesia. As we have already discussed about the local anesthesia, today we are going to discuss about the maxillary nerve block. So before discussing the blocks, we should know what are the type of block. Sometime your faculty will say give local infiltration. Sometime you will be told to give field block, sometime nerve block. So what is local infiltration? See, from the name it is clear, local means किसी particular area में in the particular region, in a small region, localized area, okay? Infiltration means infiltrate in a local area. Means the terminal branches of the nerve are flooded with the local anesthesia. Means local anesthesia are given in the smaller terminal branches. Example is the supraperiosteal nerve block. Then it comes the field block. From the name it is clear that field means there is something that is in a large area. Means large terminal nerve ending is flooded with the LA. Sometimes supraperiosteal or different other nerve block, intraosseous, PDL, etc. Then it's the nerve block. The local anesthesia are flooded into the main nerve trunk near to the nerve. Means that nerve is passing through some area, local anesthesia is injected there nearby. Okay. So the whole terminal branches, whole the nerve is blocked. So the sensation will be lost from that area. And that will be in a reversible manner, as local anesthesia definition tells us. So maxillary nerve block can be of the total 12 types, out of which in the dental clinic we use approx 6 nerve block very frequently. So the 12 type of nerve block are supraperiosteal type of nerve block, intraosseous type of nerve block, intraseptal type of nerve block, then the PDL injections, then PSA, that is posterior superior alveolar nerve block. It is a branch of maxillary nerve coming after the pterygomandibular fossa. Then the anterior superior alveolar nerve block and the middle superior alveolar nerve block. PSA in the case of molars, last molars. ASA in the case of incisor to first premolar, second premolar. MSA, premolars, both the premolars. And this ASA and MSA can be blocked by a single nerve block, that is infraorbital nerve block. Then we have greater palatine nerve block, GPN. Then we have the nasopalatine nerve block. I will discuss all in detail. Then we have anterior middle superior alveolar nerve block, that is AMSA. Then whole maxillary nerve is blocked, means maxillary nerve block, and the last one is the palatal nerve block and the palatal approach of the anterior superior alveolar nerve block. So taking the example of supraperiosteal nerve block, we will discuss the different nerve block in total 14 categories or 15 categories. First, in every nerve block, like take supraperiosteal nerve block, we will take intro. In the intro, we will discuss how much efficiently it can block. Then the second one, that is other name. Then the nerve to be anesthetized. Which nerve we are going to anesthetize will be discussed in this heading. Then the area to be anesthetized. See, the area what the nerve is supplying and the area to which the nerve is supplying will all be anesthetized if we are giving the whole nerve block. Indication, there are some instances, there are some cases in which we give this nerve block, which are the contraindication point where we will give this nerve block. Is there any alternative that other than this nerve block. Then we will discuss about the different landmarks or the anatomical positions near to which the block will be given. The amount of local anesthesia to be deposited will be discussed. Then we will discuss the aspiration. In the two plane we will aspire the injection, and then we will discuss the positive or negative aspiration. Positive aspiration and the negative aspiration will be given with the help of some percentage. Then we have advantage, disadvantage, and then we will discuss the complication of the nerve block. And at the last, we will discuss the techniques of the nerve block, how we are going to give the particular nerve block in a particular area. So this all will be discussed in this heading, and we will discuss the first one, that is supraperiosteal, second PSA, third ASA, MSA and the infraorbital, fourth greater palatine, fifth nasopalatine, and the last one, that is maxillary nerve block. So these are the total 6 headings of the nerve block in the maxilla that we will use in day-to-day dental clinical practice, and we will be using this nerve block in the patient. So we will discuss all these 6 topics here in the online schedule. So thank you. That's all for today. Please do like, share and subscribe to our channel Ocean of Dentistry, and you can also discuss the notes, and also you can follow us at Instagram, the link of all of which has been given in our description box. Thank you. That's all for today.